Bismillahirrahmanirrahim. Quote of the day: Nations are born in the hearts of poets, they prosper and die in the hands of politicians. Ilama Iqbal. Today, my topic of presentation is influenza. I am Dr. Ahmad Wahid Khan. Supervisor is Professor Dr. Saira Afzal. Learning outlines. Introduction, burden of disease, epidemiological determinants, prevention and treatment, recent advances, and MCQs. Introduction. Influenza, commonly known as the flu, is an infectious disease caused by influenza viruses. Symptoms range from mild to severe and often include fever, running nose, sore throat, muscle pain, headache, coughing, and fatigue. Burden of disease. It is truly an international disease. Worldwide, the annual epidemics are estimated in about 4 to 5 million cases of severe illnesses and 3 lakh to 5 lakh deaths. It spreads with traveler worldwide. Annual global incidence of influenza in children is up to 30% and in adults it's up to 10%. Flu pandemic. Spanish flu pandemic, 50 million deaths in 1918 by influenza virus. In 1957, Asian flu pandemic, 1 million deaths. Hong Kong pandemic, 1 million deaths in 1968. And in 2002, SARS epidemic, 774 deaths. H1N1 pandemic, 284,000 deaths in 2009. MERS epidemic, 858 deaths in 2012. And in COVID-19 pandemic, it's about 67,594 deaths on 6th April 2020. Types of influenza virus. There are four types of seasonal influenza viruses: type A, B, C, and D. Influenza A and B viruses circulate and cause seasonal epidemic of disease. Influenza A viruses are further classified into subtype according to their combination of the heme agglutinin and neuraminidase, the protein on the surface of viruses. Currently circulating in humans are subtype A, H1N1 and AH3N2 influenza viruses. The AH1N1 is also written as AH1N1 PDM09 as it caused the pandemic in 2009 and subsequently replaced the seasonal influenza AH1N1 virus which had circulated prior to 2009. Only influenza type A viruses are known to have caused pandemics. Influenza B viruses are not classified into subtypes but can be broken down into lineages. Currently circulating influenza type B viruses belong to either B Yamagata or B Victoria lineage. Influenza C virus is detected less frequently and usually causes mild infection, thus does not present public health importance. Influenza D viruses primarily affect cattle and are not known to infect or cause illnesses in people. This is the epidemiological triad: host, agent, and environment. Epidemiological determinants. Agent factors. Agent factor is RNA enveloped orthomyoxyviridia 0.8 to 0.12 micron in diameter. Three subtypes ABC, structure of influenza virion, H heme agglutinin and N neuraminidase. Host factor age, it affects all ages, sex, both genders affect equally. Immunity subtype, specific antibodies against HA and NA are important. Environmental factors include individual climate change, vaccination, healthcare access, workplace policies, school policies, and neighborhood. Chain of transmission. Reservoir is animal and birds. Source of infection cases and subclinical. Period of infectivity nasopharynx from 1 to 2 days before and 1 to 2 days after onset of symptoms. Mode of transmission, it transmit through droplet nuclei into droplet infection in the respiratory tract. Symptoms include respiratory disease, abrupt onset of symptoms, fever up to 104 degree Fahrenheit, chills, muscle ache, pains, sweating, dry cough, nasal congestion, sore throat, headache, malaise, and fatigue. Complication includes primary influenza, viral pneumonia, secondary bacterial pneumonia, croup, myositis, myocarditis, toxic shock syndrome, race syndrome. Level of prevention. Number one, primary prevention. Remember the three W's to protect yourself and other this season. Wash your hands, wear your mask, watch your distance, and also get your flu shot. B. Specific protection immunization. Influenza vaccine, often called flu shots, are vaccines that protect against the four influenza viruses. Most flu vaccine are flu shots given with a needle, usually in the arm, but there also a nasal spray flu vaccine. The CDC recommends annual influenza vaccination for everyone age 6 months or older. Vaccination is especially important for people at high risk of influenza complications. Influenza vaccine, these are inactivated subunit, intramuscular or intradermal, live attenuated vaccine which can be given intranasally. Trivalent vaccine contain three inactive viruses, type A, type B, and type A H3N3. Quadrivalent influenza vaccines introduced for the 2013 to 2014 season contain the same antigens as trivalent vaccine, with the exception that quadrivalent vaccine contain two type B strain. Vaccine viruses are grown in chicken eggs and the final product contain residual egg protein. The vaccine is available in both pediatric 0.25 ml dose and in adult, which is 0.5 ml dose formulations. This is a schedule for vaccine or influenza. Age group 6 to 35 months. Dose include 0.25 ml. Number of doses include 1 or 2. Age group 3 to 8 years. The dose include 0.5 ml and the number of doses are 1 or 2. The age above 9 years, dosage include 0.5 ml and number of doses are only 1. Reasons for getting a yearly flu vaccine. The first reason is that because flu viruses are constantly changing, flu vaccines may be updated from one season to the next to protect against the most recent and most commonly circulating viruses. September and October are generally good time to get vaccinated. Vaccination in July and August is not recommended for most adults but can be considered for some groups. While ideally it is recommended to get vaccinated by the end of October, it's important to know that vaccination after October can still provide protection during the peak of flu season. The second reason that annual vaccination is recommended is that a person's immune protection from vaccination decline over time and annual vaccination is needed for optimal protection. Contraindication of vaccination. Severe allergy to chicken eggs, severe reaction to previous vaccination, develop GBS within 6 weeks after getting vaccination, children less than 6 months of age. Secondary prevention, the sign and symptoms of influenza can vary by age, immune status, and the presence of underlying medication condition. Uncomplicated influenza can have symptoms and signs like fever, muscle ache, headache, lack of energy, dry cough, sore throat, nasal congestion, and possibly running nose. A number of tests are available to detect flu viruses in respiratory specimens. The most common are called the Rapid Influenza Diagnostic Test (RIDTs) work by detecting the parts of the virus antigen that stimulate an immune response. These tests can provide result within approximately 10 to 15 minutes, but may not be as accurate as other flu tests. Therefore, you could still have flu. Even though your rapid test result is negative, other flu tests called rapid molecular assays detect genetic material of the flu viruses. Rapid molecular assay produce result in 15 to 20 minutes and are more accurate than RIDTs. Treatment usually person will need nothing more than rest and plenty of fluids to treat the flu. But if have a severe infection or are at a risk of complication, doctor may prescribe an antiviral drug to treat the flu. Antiviral drugs can help treat flu illnesses. Antiviral drugs are different from antibiotics. Flu antivirals are prescription medication, pills, liquid intravenous solution, or an inhaled powder, and are not available over the counter. Antiviral drugs can make illness milder and shorten the time of sickness. Recent updates. Obesity as a risk factor for severe influenza infection in children and adolescents, a systematic review and meta analysis. Abstract. Obesity has been recently identified as a predisposing factor for a worse prognosis in viral illnesses such as SARS-CoV-2. However, its roles in children with influenza is not yet clarified. The current systematic review and meta-analysis aims to assess whether obesity is a risk factor for either hospitalization or a worse prognosis when hospitalized among children infected by influenza. We systematically search the following database using a structure algorithm: Medline Clinical Trials, COVE, and Cochrane Central Register of Controlled Trials. A statistical meta-analysis was performed using the meta package in our software, and included studies were evaluated using Newcastle-Ottawa scale among children with influenza. Obesity increased the odds of hospitalization with a pool OR of 1.89. When hospitalized, children with obesity were also more likely to have a worse outcome than their healthy weight in counterparts, with a pool OR of 1.24. In an effort to lower heterogeneity, a leave one out meta-analysis was conducted. Publication bias was assessed with the visual inspection of funnel plots and the trim and fill method. Certainty assessment was evaluated using the grade score. Conclusion: the finding of our meta-analysis suggests that obesity in children with influenza is associated with the worst prognosis, both hospitalization and ICU admission death. Systematic review of the efficacy, effectiveness, and safety of recombinant heme agglutinin seasonal influenza vaccines for the prevention of laboratory confirmed influenza in individual greater than 18 years. Abstract. The most effective means of preventing seasonal influenza is through vaccination. In this systematic review, we investigated the efficacy, effectiveness, and safety of recombinant HA seasonal influenza vaccine to prevent laboratory confirmed influenza. A systematic literature search was conducted in the electronic database and gray literature sources up to 7 February 2020. Randomized controlled trial and non-randomized studies of interventions were eligible for inclusion. The search returned 28,846 record, of which 10 studies of recommended HA influenza vaccine met our inclusion criteria. One study found that the Quadrivalent combinant HA influenza vaccine had higher relative vaccine efficacy in preventing laboratory confirmed influenza during the 2014 to 15 season compared with traditional quadrivalent vaccination in adult age greater than 50 years. In a subgroup analysis, higher RVE were reported for influenza A but not for B. Tri- Another study reported higher efficacy for the trivalent recombinant HA vaccine compared with placebo in adult age 18 to 55 years, with the exception of a higher rate of the chills. The safety profile of the recommended recombinant HA vaccine was comparable to that of traditional influenza vaccines. The evidence base for the efficacy and effectiveness of recombinant HA influenza vaccines is limited at present, although one study found that recombinant HA influenza vaccine had a higher RVE compared with traditional quadrivalent vaccination in adult age greater than 50 years. MCQs. Question number one. Influenza is a serious global health threat that impacts all countries every year. Which of the following influenza viruses serotype that cause most of the epidemics? The correct answer is A, type A. Question number two. Influenza is a viral infection that attacks the respiratory system. Which of the following is not the common symptom of flu caused by the influenza virus in adults? A is fever, B is cough, C is rashes, D is headache, E is sore throat.
C.
Yes, the correct answer is C. Question number three. In which year did the influenza pandemic was the most severe pandemic in history which killed millions of people? It was caused by an H1N1 virus with gene of avian origin. Options are A is 1945, B is 1900, C is 1928, D is 1918, E is 1998.
C.
The correct answer is D, 1918. H5N1 is the highly pathogenic and contagious causative agent of the H5N1 flu. Which of the following is the source of H5N1 infection in human? A option A is birds, B is pigs, C is ferrets, D is cattle, and E is dogs. The correct answer is birds. Question number five. Immunity to disease is achieved when there are antibodies to that disease in person system. Which of the following virus can give lifelong immunity to the disease after prior infection or immunization? Options are influenza A virus, option B is influenza B virus, C is influenza C virus, D is measles virus, E is influenza D virus. The correct answer is D. Question number six. The most common route of transmission of the influenza virus is airborne droplet. Which of the following type of the virus is considered highly contagious and is known to spread rapidly from person to person? Option are influenza A, B is rhinovirus, C is influenza B, D is HIV, E is herpes. The correct answer is option A. Question number seven. Which of the following statement reflects the pathogenesis of influenza virus? Viremia is common. Pneumonia is not associated with secondary bacterial infection. The virus enters the host in airborne droplets. Viral infection does not kill cell in the respiratory tract. E is the virus frequently establishes persistent infection in the lungs. The correct option is C. Question 8 is influenza viruses spread when people with flu, cough, sneeze, or talk and sending droplets with virus into air. Which of the following statement is not correct about the preventive measure of the influenza virus? Option A is washing hands more often helps. B, a sick person with flu should stay isolated at least for 24 hours. C, over the counter antiviral drugs are available for the influenza viruses. D is live attenuated and inactivated viruses. Both are used for vaccination. E is detect flu virus by respiratory specimen. The correct option is C. Question 9. A 16-year-old girl came to the clinic with a sore throat, fever, and headache. The symptom resembles seasonal influenza flu. Which of the following primary sample specimen is collected for the laboratory diagnosis of influenza virus? A. Option A is blood. Option B is sputum. C is urine. D nasopharyngeal washing. And E is stool. Correct option is D. But question number 10 is what is the best time of the year for person to be vaccinated against the influenza? Options A is vaccination by the end of October. B is in summer before next peak flu season. C, flu symptoms developed. D, anytime it makes no difference. E, vaccination in July and August. The correct answer is A, vaccination by the end of October. This is the key for the MCQs. These are the references through which this presentation has been made. And thank you. Here is the link of our YouTube channel.